My name is Pam. I'm 75 years old. I've been on Medicare for 10 years, and I've been on a lot of different types of Medicare plans. I started out on a Medicare supplement where I paid a monthly premium and had a separate plan for my Part D drugs. And after a while, because I was relatively healthy, I think I could perhaps make a better financial decision if I looked into Medicare Advantage. And Medicare Advantage is just a different type of coverage. You have, instead of paying a monthly premium, you pay a copay as you go. And the reason I am very familiar with it is in 2006, I decided to become a Medicare agent. A very good friend of mine became a Medicare agent in 2006, and he said, "Pam, you would absolutely love it. It's really like a ministry. You're really just helping people. And it's learning about things that concern me too. I'm a consumer, I'm on Medicare, and I want to make sure that I know what's going on with these plans." So anyway, I decided to try Medicare Advantage, and I've tried every company, every major company. Every year I set out to do a new plan during the annual election so that I can see how the customer service is and see how the benefits are delivered, and be able to give honest feedback to our clients, because I've been doing this for 20 years, and we do have hundreds of clients in the Ohio, Kentucky, and Indiana area. So anyway, this fall I had a visit with my primary care doctor. A lot of these plans, including the one that I was on, had a 0 visit to the primary and a 0 annual physical. And don't skip that annual physical, because during mine, they found a serious health issue. And the primary care was so on top of it. They literally called me at 9 o'clock at night and said, "You've got to get to the hospital right away. You've got a serious problem with your blood." And it turned out to be leukemia. And the folks at St. Elizabeth diagnosed it right away with the blood work, and they got me into an oncologist the very next day at the St. Elizabeth Cancer Center. And so I was really able to treat a serious illness before it got serious. And that annual checkup really saved my life and put me into a treatment plan. But then I have to think about how I'm going to have ongoing treatment. It's a chronic condition. So how am I going with this leukemia? How am I going to stay alive for the next 10 or 15 years, I hope, right? So when I tried to look out at the market and look at all the different healthcare plans on the market for 2025, I decided to join the Cigna plan, the Cigna Signature HMO. Now, I'm not afraid of HMOs. I look at the network, and if my doctors are in the network, I'm happy. I know that emergency care is covered anywhere in the United States, and some little emergency care is even covered overseas. But just to look at things that were going to matter for my future. I didn't know what kind of a treatment plan I was going to have. I didn't know if it would be chemotherapy. I didn't know if I'd have to have surgery or any other specialist involved, and I didn't know if I'd have to go to different places like Cleveland Clinic or somewhere outside the area. So I chose the Cigna plan, and I also helped about 35 other people choose Cigna last fall, and I carefully monitored everybody's adaptive experience into Cigna. I helped people get the website so we could see our claims, and we could also see providers, do things really easily online. And one thing that really thrilled me about the plan is not only is it health care, but they also gave us some perks. They gave us a Visa card right away. It arrived in the mail without having to be activated. And I can use that. I had $150 every quarter to use at outlets like Walgreens, Dollar General, Dollar Tree, and I could pick up things that I needed that were over-the-counter things. So I had 2 cards with Cigna. I had my card that I present at the doctor, and then I have the Visa card that I present to get those over-the-counter items. You need eye drops, we need swabs, we need aids, kinds of things like that. And the card was very handy during the year. Plus you can add money to it by doing healthy things to support your health. So if you get a vaccine or if you have another primary care visit, things like that, to update your health, and they put more money on the card. So worked out really well financially. I had $3,000 worth of dental and also some vision coverage and hearing aid coverage. So anyway, it was a great plan for me, and I'm going to stay with it for 2026. So if you would like to have more information about this plan, all 5 of our agents are certified and ready to offer. So you can go to our website and contact one of them, and they'll be able to look at this plan and measure it against any others you might be considering. So thank you.